Uh, yeah, there are certain substances or experience in Mother Nature which bring about a peculiar change in the brain in a specific area which is very close to the emotional cortex. And that area is called the motivational or reward circuit. And two structures which are primarily important in this network are ventral tegmental area and the nucleus accumbens. Now, what happens is with any kind of addictive substance or an experience, these areas usually would respond in a particular way, and people who are going to have an addictive change in their consumptions and their lifestyles would respond differently. It's exactly similar to what happens in diabetes. So people who are bound to get diabetes have a genetic vulnerability, and their pancreas respond differently to the glucose burden that the person consumes because of his lifestyle. Similar thing happens in addiction. So ventral tegmental area and nucleus accumbens in people who are genetically vulnerable for addiction would respond differently and would show different chemical reactions, which would probably go and start affecting the local areas in the vicinity and would have a syndrome complex called addiction. These syndrome complexes have multiple changes in the thinking, feeling, and behavior of the individual, and the person's social world, his person's decision-making world. All these things start collapsing, and that's where you get a full-blown addictive disorder. But mind you, it's not necessary that from the very first interaction that the person has with the addictive substance, similar thing would happen. It's a gradual progress with neurochemical damage happening in these areas, which leads to some changes in his thinking, feeling, and choice making that leads to the addiction complex. So that is what the neuroscience knows as of now.